Hello, everyone. This is Becky O'Gwen, the Strategic Communications Manager with Tri-County Health Department. Thank you for joining our remote press briefing. We're having a remote press briefing to comply with social distancing guidance. So that's why we're all calling in remotely and keeping our 6 feet of separation. We are going to start with Dr. Douglas, who will talk about our public health order. You can ask questions in the chat and we'll answer them based on a first come, first served basis after Dr. Douglas and Dr. Albanese are done speaking. Please make sure you stay muted throughout the call. I think we muted you anyway. We're only going to take calls or questions by chat. So thank you. And we'll get started. Dr. Douglas, are you ready?
Yes, can you hear me?
Yes, I can.
Okay, terrific. So good morning, everybody. This is Dr.
Can
John
see you
Douglas.
as well.
I'm sorry?
We can see you as well.
Oh, okay, terrific. Dr. John Douglas, Executive Director of the Tri-County Health Department. I appreciate our PAO, Becky, pulling this together this morning for us. I'm joined, as she's already mentioned, remotely. We're in different places. I'm actually self-isolated because of a respiratory infection. Joined today by Dr. Bernadette Albanese, our medical epidemiologist at Tri-County. So today, Tri-County is announcing that we're joining the Denver Department of Public Health and Environment as of Monday, the Jefferson County Public Health Department, and the Boulder County Public Health Department as of today in announcing stay-at-home public health orders. This takes effect in our jurisdiction on Thursday morning, March 26 at 8 a.m. And it is currently planned to continue until midnight or 11:59 p.m. on Friday, April 17th. The reason for implementing these orders is similar to those that have driven Denver, Jeffco, Boulder, and frankly, cities and states across the country to take these steps. We do have widespread transmission of COVID-19 throughout many parts of Colorado, certainly in the metro area and all 3 of our counties. And while we absolutely don't know everything about COVID, we do know it spreads person to person, including from people with very mild symptoms or frankly, even asymptomatic people who don't know that they're sick. A number of different social distancing measures have already been implemented by the governor. We felt that in the face of evidence of ongoing transmission and particularly concerns about overwhelming hospital capacity, that this was an appropriate short-term next step to make to give us our best chance of curbing transmission, preventing illness, and perhaps most critically, preventing hospital capacity, the ability to put people in the hospital, the ability to put them in an ICU if they get really sick, or even on a ventilator if they get sicker than that, time to prepare and recover. So the goal of the order, and by implementing it, we hope to slow the spread of disease so the healthcare system can minimize death and give public health and the healthcare system time to get needed supplies. We badly lack personal protective equipment right now, for example. Ramp up testing, that's been lagging, it's getting better, as well as to better determine how we can curb the spread. Again, big picture, these measures are more extended than what had been done before. We're aware of community impact, but we strongly believe that by flattening the curve, we can begin to reduce the number of people who will get sick from COVID. What does the order mean? It's not shelter in place. It's not lockdown. It's stay at home. That's really the message. There are a number of exceptions. It's a lengthy order, most of which actually outlines the exceptions. But for the most part, we want to encourage everybody to stay at home. As already indicated, the order is currently slated to go through April 17th. I would note that's a different end date than Denver. Denver is currently April 10th. Many of the governor's orders also have different end dates. We get that this is somewhat confusing. We felt that the extra week would provide greater opportunity for benefit and greater opportunity for us to measure the impact of that benefit. In a nutshell, The order allows folks to leave home. They're not locked down for essential purposes. That includes getting medical care, medical supplies, groceries, pharmaceuticals, necessary supplies for household repairs, household and personal cleanliness, picking up materials from your child's school for the distance learning that many schools are undertaking right now. Very importantly, going outside for physical activity. In all of these settings, we are encouraging social distancing. Social distancing means staying 6 feet away from other people. That's the best estimate of the distance is required for respiratory droplets to be moving from person A to person B and transmitting infection. The biggest part of this really is probably in some ways the going to work. And we tried to do the best job we can of defining both essential reasons that folks can go out, as well as essential businesses and critical infrastructure and vital government services that remain open. We are aware of many questions about exceptions to this. We've tried to be as clear as we could in the orders, and we've also, I would emphasize, tried to be as consistent with the orders of the others as possible. We believe that although we live in different counties, there are different contexts, we have different businesses, that for everyone, some of us who live in one place and work in another, many of us who cross county lines as part of our activities of daily living, it makes a whole lot of sense to have things as consistent as possible. What we will be doing to determine the duration of the orders, and frankly, even if they could be lifted before April 17th, is measures to reduce transmission. Are we succeeding on that front? And measures to bolster healthcare capacity. So with that, I will turn it over to Dr. Albanese to say a little bit more about the issue of what's happening vis-a-vis transmission in our community.
Hi, thank you, Dr. Douglas. Again, Dr. Bernadette Albanese here with Tri-County Health Department. I'm going to expand just a little bit on some of the background that Dr. Douglas provided to see if we can all kind of get grounded in what the situation is one of my primary roles here at the Health Department is to assist with all of our investigations of cases as they come in. So I hope it's crystal clear to everyone at this juncture that COVID-19 spreads primarily from an infected person to another, primarily from people who are experiencing symptoms and are sick to another person. When an infected person coughs and sneezes, they release respiratory droplets into the area immediately around them, hence the 6-foot radius. And if there are other people within that area, they risk of having those droplets either land directly on their face, their eyes, their nose, their mouth, and inoculating in that way. If an infected person coughs or sneezes into their hands and then does not immediately wash their hands and then shakes other people's hands or has physical contact with other people, that's another way that those other individuals, if they get that germ on their hand and then touch their eyes and nose and mouth without first washing their hands, how that disease can get transmitted. We're still evaluating to what extent environmental contamination contributes to the spread. So again, if someone coughs and sneezes and does that on a tabletop or a keyboard, and then another person who is well touches that area shortly thereafter and then touches their eyes and nose and mouth, that it may get spread that way. So this disease is spread from person to person. This is all about people interacting with one another in close proximity and for prolonged periods of time. That is the issue. So I'm going to use an analogy of an iceberg. I've been using this to try to explain our situation here. So we know that there's been challenges with testing right now, with the testing that's available in Colorado, either through the state laboratory, through commercial laboratories that provide laboratory services to providers all over the state, and to now some of our major hospitals that are testing within their hospital laboratories. The focus is going to be testing on people who are hospitalized and are quite ill, healthcare workers who have illness and we need to make important decisions about their ability to work, and then people who are at risk for having a harder time managing this illness and at risk for having serious complications. So So our seniors, our people with weak immune systems, individuals who have chronic health conditions. That's where we're getting a lot of the testing from at this point. And so I'm calling that the tip of our iceberg, right? So there's a part of an iceberg that's above the water and a part that's below. But what's below the water is a lot of other people. As Dr. Douglas mentioned, we know that perhaps up to 80% of people with COVID infection are going to have mild symptoms, and they're not necessarily going to recognize that their symptoms are actually due to COVID infection because maybe they don't feel so poorly. But what happens is as disease becomes widespread in our communities, which we believe is happening now, the bottom of the iceberg, which are the people who aren't tested or the people with mild symptoms, are pushing the top up. And so when we start seeing more severe disease and more hospitalizations and big strains on our healthcare systems, it is indicating to us that there is much more disease going on and being spread that we have not yet been able to completely wrangle in. So early on, so I'm going to just give you some quick numbers here. For example, on March 17th, we had 160 cases reported in Colorado from positive laboratory testing. Less than a week later, that was 4.5 times higher at 720 cases. A day later, it increased from 720 to 912 cases. This is a rapid rise in the number of positive tests that we are getting reported. In Tri-County's jurisdiction of Adams, Arapahoe, and Douglas counties, on March 17th, we cases. 4 days later, that more than doubled. 3 days later, that more than doubled again. When we are seeing this rapid rise in the tip of the iceberg that we are getting test results back, it means the bottom of the iceberg is pushing it up. And we're still getting a lot of disease spread, even despite our efforts. So early on, when we were having issues in Colorado and just having a scattering of cases, state and local public health agencies were attempting to contact those cases individually, tell them about their infection, and try to identify who they might have been, who they might have exposed, and to try to intervene and ask those exposed persons to stay home. We then expanded that work to start using very public messaging about staying home when you're sick, regardless of what your symptoms are, if it might be COVID infection. The concept of social distancing and staying 6 feet away, and using self-quarantine, meaning if you think you are exposed, stay out of public places and monitor yourself for 14 days, which is a time that it takes if you've had an exposure before your symptoms might develop, up to 14 days. But yet, despite those efforts, the iceberg kept pushing up. We are starting to see more sick people, more hospitalizations, providers seeing more patients with illness that could be consistent with COVID. We've been observing what's been going on in other states. There's a lot of lessons learned in other states around the country, like California and Seattle and New York City, about when they hit this acceleration phase, what might happen. And so, as Dr. Douglas carefully explained, we are now at a point where we need to step up efforts once again. The disease is still spreading despite our efforts. We are having issues with noncompliance and people not following and heeding our advice. And so we need a more widespread and a more strict measure in order to break the chain of spread. We are doing this simultaneously with other counties in the Denver metropolitan area. Why? Because we are a densely populated area. We have a lot of people that live in the metro area, and we were trying to do this in conjunction with our partners in the area so that geographically in the metro area, we ask people to stay home. We want to limit the destinations that people are permitted to go while sustaining essential services for medical care and what's necessary for daily living, so that we can try to have a sharp impact on this disease spreading and to keep people away from one another and to keep sick people at home. So I'll stop my comments there. Thank you very much.
Thank you very much, Dr. Albanese. I want to emphasize, as Dr. Albanese said, one of the biggest issues we've had has been testing inadequacy. And even though the testing measures that she cites are really quite dramatic, we know that those, as she, I think poignantly put it, tip of the iceberg, not giving us anywhere close to the true picture. And I think maybe quite important to emphasize, a test that's positive today represents an event that probably happened 10 to 14 to 17 days ago in terms of transmission, because it takes you a while, 7 to 10 days after you were exposed, to get sick. And then it takes you a while after you get sick to get into a place where you can be tested. And then it takes a while for us to learn about those test results. So that we are working right now with what we think is what we know is a growing epidemic, but what we know is only partially and retrospectively measured. And I think for me, that combined with what I was hearing from my hospital partners about literally weeks away from getting overloaded is really what led me with my other public health partners in a coordinated way to take this action today. Again, thanks, Dr. Albanese. Thanks to Becky for organizing this. And I think, Becky, I'd be happy to now, with Bernadette, take questions that anybody has.
Great. Dr. Douglas, I think you just answered this question from Kathy at KOA about why this timing is so critical, referring to the timing of this public health order. Would you mind answering that briefly again?
Yeah, sure. The timing is not driven by Swiss watch mathematical precision. However, it is driven by daily drumbeats of increases in the epidemic and projections, both by models from other places, by experience in other cities, and by modeling that's been done in Colorado, that we're probably literally weeks away from a situation where hospital capacity gets exceeded. So should we have acted a couple of days ago? Maybe, probably so. Do we lose time with each day that we fail to act? I think we do, and that's why we're acting today.
Great, thanks, Dr. Douglas. The next question comes from Colorado Community, and we're going to have Melissa Sager, our policy expert at Tri-County, answer this question. There have been questions raised about Tri-County's authority to do this, especially as a non-elected group making an emergency order. Can you address those questions? Melissa?
Actually, John may be the best one to answer this.
Okay. John, can you answer that?
Sure. Yeah. Let me clarify one thing. This is not a declaration of emergency by Tri-County. This is a public health order. We have a national, state, and each of our 3 county declaration of emergency. We're authorized by Colorado statute as the health department of the jurisdiction to issue public health orders when they're needed. There are a number of statutory elements. I'm not a lawyer. Our lawyer tells us that revised statutes 25-1-506, 508, 509, and 516 contain the language that allow us to take these orders. Once again, not a declaration of emergency. That's not our job. But issuing public health orders to reduce a public health problem, in this case, stemming a pandemic, we do have the authority to do that as the district health department of record for these 3 counties.
Thanks, John. This is Melissa, and I'll just add that that particular section that you referenced of law passed in 2008 under the Public Health Act, and again, the authority being in public health emergencies to issue these orders.
Dr. Douglas, we also have another question about the order from Ellis Arnold at Colorado Community Media. Is the list of essential businesses the same between Tri-County stay-at-home order and Denver stay-at-home order?
The list is as close as we could get it. I think it's about 99.5% the same. There are a few variations between us and Denver. There are no variations that I'm aware of between us, between Jefferson County, Boulder County, and ourselves.
Great. This next one is from Connor at Denver Westward, also for Dr. Douglas. Why did you include recreational marijuana shops and liquor stores as essential businesses? Was your decision guided in part after seeing the chaos that happened in Denver?
We were, I think you could argue that neither of those things is as essential as groceries or pharmaceuticals. We were trying to be attentive to coordination. I think one of the concerns was if one county closed liquor stores and another county didn't, that there would be disproportionate social movement of people who frankly wanted to buy alcoholic beverages there. And we would do a better job of, if you will, spreading things out. Our goal here isn't to deny people alcohol or marijuana. The goal is to try to spread things out and prevent social contact. And we thought we could do the best job of that by being as consistent as possible with Denver.
Great, thank you. Our next question is from Kara Mason with the Sentinel. Some local leaders have expressed concern over a patchwork approach. Is a local approach best from a public health perspective, or would it have been better for the state to issue something more broad?
Honestly, we think the more consistency there is in places that share a transmission community and share healthcare resources, the better it would be. That's why we tried to work as closely with our Metropolitan Health Department partners as we did and have. And frankly, why I think a statewide order could have been and would still be an advantage in terms of working together clearly, effectively, and protectively of healthcare resources.
Great. This next question is from Dana Caulfield. These 3 county groups now will shelter in place 7 days past Denver. Is Denver expected to realign?
At this point, I don't know whether Denver's expected to realign or not. We're in regular communication with our colleagues in Denver. We'll be looking really at many of the same metrics in terms of transmission prevention or transmission reduction and hospital surge. So I guess the best thing to say is stay tuned. They might extend. I certainly wouldn't want to speak for their department or the mayor. We might reduce the duration of this. Once we are convinced that we've got evidence of reduced transmission and evidence of bolstered healthcare capacity, I don't want to leave this any place any longer than we need to. So I think further alignment in either direction is certainly a possibility.
Right, thank you. This next question is from Katie Weiss at CBS, but I don't think we can answer it because it talks about a specific living facility. So Katie, we will get back to you on that. The next question is from Stephen Vetter. Are there going to be any additional announcements concerning narrowed down location of infection cases? For example, towns and communities. I can answer that one. It's on our website, all of the towns and case counts by city and county. I know there are HIPAA and other privacy mandates to be adhered to, but how does mentioning towns or communities jeopardize that? It doesn't. That's why we put those on our website. There have been a bevy of questions arising from the closure of a few businesses in the 6 towns along I-70 immediately east of the metro area, and there are unconfirmed reports that employees of those businesses have been infected. Dr. Albanese, can you speak to that at all?
Becky, can you repeat that question? Because I'm having a hard time finding it in the chat. What was the question again?
It's a really long question, but there have been a bevy of questions arising about the closure of a few businesses in the 6 towns along I-70 immediately east of the metro area. And there are unconfirmed reports that employees of those businesses have been infected.
So I don't think during this conversation we can get into the details of any particular investigation. Please realize, though, that the persons being tested do not represent everyone who has COVID-19 in the Tri-County area, the metro area, or in Colorado. We are doing this broad swipe of stay-at-home public order to keep people who have milder symptoms home and keep them away from other people so that we don't continue spreading infection, and to really kind of, as Dr. Douglas mentioned, sort of make room within our healthcare system so that people who are having a harder time with their symptoms, a harder time managing their symptoms, creating complications in their underlying illness, people who are maybe developing pneumonia, to make sure that they can access care and be appropriately evaluated and taken care of. And so you can expect that people on your block or people that have in your workplace or that people that you have socialized with either have COVID now, have COVID before, or may get COVID in the future. Okay, we're not going to be able at this juncture to use testing as our sole decision making about who's infected. The symptoms, the more serious, so the symptoms of COVID can start out as a mild illness. You may or may not have fever. You can have sore throat initially, cough initially, any combinations of those, singularly of those. Some associated symptoms can be runny nose, nasal congestion, extreme tiredness, body aches. And some people, that might be all that they have, and it won't be enough for them to seek care, and it won't be enough for them to be tested. But they're still contagious. Their illness can still be due to COVID, and they're still contagious, and they have the ability to spread it around. The more serious symptoms of COVID really involve a greater impact on your respiratory system and your lungs, with shortness of breath, difficulty breathing, potentially problems with pneumonia, and then it escalates from there. And again, we are seeing our higher risk population are our seniors and people with weak immune systems and people with chronic health problems that we worry the most about. So I can't necessarily confirm whether someone in a workplace had COVID. I can tell you that it's a pretty darn good possibility as we are moving into this acceleration phase, and our flu season is coming down. Well, the winter respiratory viruses that we normally see, starting in October, November, December, running through our winter months, start clearing out as we get into March and April. And so when you have these respiratory illnesses, a higher proportion of people are going to have their illness due to COVID than due to these other illnesses.
Thank you, Dr. Albanese. One more question in line with that. Are you seeing any difference between infection or spread rates between rural areas and more urban metropolitan areas?
We haven't necessarily tried to tease that out. The case counts that I gave you earlier in our conversation, for either combined for the whole state or combined for our 3 counties. So we hadn't necessarily teased in terms of density. And again, acknowledging that those case counts only represent some proportion of all of the disease, the iceberg below the water.
Great, thank you. This next question is for Dr. Douglas, and it comes from Ashley Michaels, and it's how will this be enforced?
So this is actually, as Denver's mayor said the other day, largely going to be relying upon citizen cooperation. There are 1.5 million people, for example, living across our 3 counties, and it would be, beyond, imaginable plausibility for us to surveil 1.5 million people. That's not our goal. What we're looking for is, number one, hopefully greater cooperation created by the fact that this is not an encouragement. This is a public health order. If you don't comply with the order, you're actually breaking the law. There are penalties. These are standard penalties that are outlined in the state statute for violating a public health order. They are fines of up to $5,000, and they are actually imprisonment in jail of up to 180 days. Now, we don't have really any serious intent of fining people to that level, nor do we want to, from an epidemic perspective, put people in jail. Certainly our law enforcement partners don't do that. We will, however, be responding to citizen complaints, and we will be developing mechanisms to try to survey areas where gatherings have been reported before. The goal of the response of any complaint is to have the health department, not law enforcement, respond to it. The big goal is to say, hey, you may not be aware, this is really concerning. This sort of gathering can spread infection. It's not actually allowed under law right now because of the order. If we run into a particularly flagrant unwillingness to cooperate with that, then we certainly will ask our law enforcement partners to help us with that.
Dr. Douglas, do people need documentation that they work at a place considered essential?
They do not. We're not at this point in time anticipating anything like, as Sheriff Tyler Brown of Arapahoe County put it on a town hall last night, checkpoints, which are the kind of things that you might imagine, which is when you'd have to pull out and show that documentation. So nothing at all in that direction envisioned. Now, I would note that there are places in the world where extremely severe outbreaks have occurred, and extreme measures were taken that included that. That's absolutely not what we're considering, but frankly, we're trying to do this now to avoid that sort of scenario needing to develop in the future.
Okay. This is also from Ashley Michaels with Box 31. What should people who live within a county covered under this public health order, but work in a county that is not under stay-at-home orders?
So that's a confusing topic, and it came up on the Denver discussion the other day, and hopefully we'll get less confusing the more and more of us who join in. At this point, you are obliged really to pay attention to public health orders wherever you are. So if you live here and you work in Elbert County, you're obliged to follow our public health orders. If you live in Elbert and work here, you're obliged to follow those orders. So it really is based on your location and not your residence. And again, the more of us who adopt orders like this, the less that sort of really obvious confusion hopefully will occur.
Okay, from Colorado Community Media North, what about the fines and penalties? How will you get residents to take this order seriously? Will you enforce this, and how will you do that? I think we might have someone from the Sheriff's Office on this call that can answer this question from Arapahoe County.
Yes, this is Sheriff Brown. That's a very good question, and I think Dr. Douglas addressed it appropriately. We're going to try to educate people on this, but the big thing that I'm really relying on is that social peer pressure, that people will say, hey, this is the right thing to do. We're listening to our medical experts, and we're trying to make sure that our community stays safe and healthy. So there are fines. There are the ability for us to enforce these. That's not our goal. Our goal is to make sure that people are adhering to the order and that we're trying to get through this as quick as possible.
Great, thank you so much. The next question is from Steve Sager from 9 News. What are the differences between Denver's order and this order? You said about 99.5% the same. What's that 5% difference?
That's a really good question, and since I gave you a number, you'd expect me to have a precise answer. Melissa, I'm going to ask you if you can try to maybe quickly pull together those differences, and so we can explain it. And if you can, I'll take a stab at it. I did want to say one more thing that really we perhaps haven't said strongly enough. As Sheriff Brown said, we really didn't want to do this. We really thought if we could have gotten cooperation with earlier social distancing, we wouldn't need to go to this step. The more we can all cooperate with it, the shorter this will go. If we could simply all stay at home, I know that's not possible, we've got exceptions, but the more we can adhere to it, the more we're going to have a situation where the parameters we're trying to address can be met. Melissa, have you had a chance in that 30 seconds to look at?
Yeah, actually, and I'll give credit where credit is due. Our partners in Jefferson County went through and redlined the Denver County's order to pull out what exactly is different. And so I can give you a few of those right now. One of the differences is outdoor activity. Boulder, Jefferson, and Tri-County have both included a provision to allow small groups of individuals to engage in outdoor activity as long as they're adhering to social distancing. So this would allow you to meet up with a person from outside of your household to walk at the local park 6 feet apart. And this was really changed. We had some feedback on mental health. And so for those individuals living alone and feeling isolated, we wanted to make sure they were able to connect with some folks in a very safe way. Another provision that we've included is an essential activity of moving. And so if you need to move from your residence to another residence, that's an essential activity that we have listed. Let's see. A lot of the provisions are very similar. We've enhanced some of the provisions just for clarity, that some of these things may be allowable under Denver's order, but we added clarifying language for things like janitorial services and security at your building, that those are essential business functions. We've added recycling and composting to solid waste. Again, that is likely included under Denver's, but we pulled that out just to make sure it was included. We've included human services under essential government functions, as well as city and county boards, our Board of Health, city and county attorney offices. Let's see. We included licensed liquor stores and marijuana dispensaries, which Denver added. And we included bicycle shops under an essential business with gas stations and auto supply. Licensed gun retailers and ammunition retailers, landscapers. I think those are the main differences.
I think we may have a more clear provision about companies that are involved in national defense work. I'm not sure Denver
right.
called it out specifically. I do want to note that we have tried to do things in common, but for example, we got some, I think helpful feedback from some of our more rural communities that if I'm a farmer and I've got livestock to protect and I may need firearms to do that. And in my part of the world, that becomes really an essential commodity. That wasn't really a situation that was so relevant for Denver, and we thought that made sense. That was one of the reasons for adding that.
Great, thank you. The next question is about volunteering from David Miles. Are there any opportunities to volunteer at hospitals or testing facilities? If so, how do you go about volunteering? Michelle's going to answer that question for us.
Great, thanks so much. So there are a couple different opportunities and ways that you can become a volunteer. Across the state of Colorado, there's an entity called Colorado Voluntary Organizations Active in Disaster, or COVOAD. And so you can look them up and assess and identify local opportunities for volunteering in your communities. Additionally, you can reach out to hospitals who also have a process to identify volunteers and vet them through their internal processes. However, at this time, they may be working on other high priorities within their hospital facilities. So a third and additional option is within the area, there's something called the Rocky Mountain Medical Reserve Corps of Colorado, or Rocky Mountain MRC. They also have a website that you can review and look at opportunities to go through the process. Again, it's very important if people are interested in volunteering that they go through these formal processes, as spontaneous volunteers create additional challenges and becomes difficult to manage when we're in a response like this. Thank you.
Great. I think we have most of the questions answered. I'm just looking through real quick. From Michael Grady, a question: were law enforcement partners and district attorneys notified that the order was going into place? Dr. Douglas?
Good question. We work very closely with our county partners, certainly all three of our sheriffs, our county emergency management partners, all of our mayors and city managers were informed about this. I don't believe that we directly communicated with chiefs of police. And Sheriff Brown, I don't know whether you can add anything to that. I am hopeful that our mayors and city managers would have done that, and to our sheriffs, but do you have anything to add to that?
No, I mean, we were in constant communication with your office, and we appreciate that. As this was coming down, we've been working on guidelines for law enforcement that we've been sharing. So we've been preparing for it with our local law enforcement partners, and there'll be some an FAQ sheet available to answer some of these questions about enforcement that we'll release here as soon as we're done with this conference call.
Great, thank you so much. We have one last question, and it's from Steve Sager. What kind of coordination have you had with the municipalities in the region? I know there's concern about an unelected entity making this call. And you sort of answered that in the last one, Dr. Douglas, but if you could maybe expound on that a little.
Sure. I know this is a question people ask. How does this guy who's not elected end up making this call? We have had several calls with leaders, city managers, mayors across the jurisdiction. There have been a couple that have been one-on-one. Could it have been more thorough in our jurisdiction with 26 municipalities? Probably so. We tried to move fast and tried to move thoroughly and tried to keep as many people in the loop as possible. I know it may be confusing, and once again, about why not elected officials making this call. Frankly, we think in some ways a gubernatorial decision, since he is elected, would have made sense, since the governor has not chosen to do that. The authority for making this decision statutorily, once again, not declaration of emergency, but the declaration of a public health orders to address a problem like an epidemic, actually rests by statute with the public health director. So that's why we at Tri-County were in the position of making that decision.
Great, thank you, Dr. Douglas. I'd just like to remind everyone that our offices, our WIC and family planning, death and birth certificate offices are still doing business online or by phone. And we do take some walk-ins on occasion when necessary. So please don't forget that those services are still available to our residents. And that's it. Thank you, everyone, for joining.